Hi guys, good afternoon. How's everyone doing today? So today we have our lovely Dr. Porter here with us today, you guys. She's gonna be answering some questions that I have for her here today. So remember, you guys, if you have any questions, any doubts, you can go ahead and put them in the chat. If you're looking forward to getting your free virtual consultation or your free in-person consultation with Dr. Porter, you can just go ahead and leave your information right here in this yellow folder in her left bottom corner. Okay, you're gonna see this yellow folder right here where you could click it and put your name, your phone number, and your email. That way we can go ahead and get in contact with you guys. Okay, so I am super excited. We're gonna jump right ahead into the questions. I see people are liking the live. Welcome. How are you guys doing today? Good afternoon. Okay, so here we go. Remember, whatever questions you guys may have, I'm gonna be reading it out to her, and then you guys can ask whatever questions you may have. Okay, I see here we're liking the live. Thank you guys. Okay, doctor, so is muscle repair always performed during a tummy tuck? Could this be an option to fix a hernia?
So muscle repair is, so in a true abdominoplasty, then yes, we do repair the muscles to fix the diastasis. So the muscle repair itself is fixing the separation in muscles that sometimes being overweight has caused, or more commonly having children. And that a hernia repair is a little bit different, because that means that there's actually like a hole in the fascia. In muscle repair, there's not. In like a mini tuck, like a mini abdominoplasty, the muscle repair isn't performed because we're not dissecting all the way up. That's just for like lower skin laxity, like below the belly button. And then in like a paniculectomy, sometimes this happens in like massive weight loss patients or something. You just have like a large amount of hanging skin, you just want the skin removed, then no, the muscle is not repaired in that. So there's lots of different.
That's nice. I didn't know.
Yeah,
it's really nice. I see here my doctor, Queen MD. Welcome, love. She just said my doctor. Thank you so much. Okay, so what happens if I get pregnant after a tummy tuck?
Nothing happens. I mean, it depends on how soon after, but usually, after a few months or whatever, the suture is kind of ingrained in there. It can stretch out. You can get skin laxity afterwards, or loose skin after, but you can still get pregnant if that's what you're asking. The results may not be the same.
How long could my recovery take after a tummy tuck?
So with any plastic or cosmetic surgery, we always say that the recovery is about 1 year. Now, does that mean you're going to be feeling miserable for a year? No. But to see like the final results, it takes a very long time for the swelling to go away. But it depends on the person. Going back to work and stuff, that's pretty much up to you. I would say 1 to 2 weeks is okay. You do have drains for about 10 days after a tummy tuck, and you are restricted on like lifting and some activities for about 6 weeks.
So I see here that we have a question. If you've had a serosal tear in your intestine and colon, would that be an issue for a BBL?
So the serosal tear was repaired, or I'm guessing it had to be. It would be on a case-by-case basis. That usually shouldn't affect it, but I would have to know more information.
Noah's asking, what is the anesthesia process like?
So it depends on what you're getting done. If it's, a tummy tuck, that there are people who do it without general anesthesia, but usually here we deal with general anesthesia to really get the muscles relaxed. General anesthesia it's a process. You go to sleep fully, a tube is breathing for you, and then you wake up, so it's a little bit more recovery on your lungs and stuff. You need to be up and walking more. Local anesthesia can be done for smaller things, or like lipo of one area, if you just wanted the abdomen done or something like that, or like the chin. That is more of like you're just kind of a normal day and just recovering from like the soreness and stuff of the surgery.
That's pretty cool. That's pretty cool. Here, PK6, the girl I asked you about the serosal tear, she says that she did get it repaired.
Yeah, you have to get it repaired. I mean, it would be a case-by-case basis, but if it's been a decent amount of time and stuff, then it shouldn't be an issue, but I don't know your whole story.
You would have to come in for a free virtual consultation or a free in-person consultation. For all the people that live here in Miami, of course, we have a free in-person consultation. And for the people that live outside of the state or outside of the country, we got you guys too. We have free virtual consultations. So let me tell you something. If you've been looking forward to becoming an iconic doll with Dr. Porter, I'm telling you now that there's nothing to stop the show. You can go ahead and leave your information right here in this yellow folder. That way we can get in contact with you guys, okay? She said, okay, thank you. Of course, love, of course. We're here to help you out. So, baby girl XOXO would much rather do general anesthesia than local. And let me tell you something. Right now, we have a promotion for Dr. Porter for chin lipo. Okay, you guys look right here, right above my head, with local anesthesia, baby girl XOXO. So, I'm letting you know now. You do not want to miss out on this amazing promotion, okay? So, we have a Blue 11. Welcome. How are you doing today? When is it safe to use jeans after a BBL?
Depends on the jeans. Are you wearing like, you know, back in the day it was jeggings, like the stretchy ones or something? You know, as long as it doesn't feel like it's compressing anything. If it's like standing jeans and no sitting jeans, I would give yourself like a month. You just don't want anything too compressive to make like irregularities.
Of course. I chose her as my doctor. I'm doing payment right now when I get the BBL. How long do I need to wait before going back to work? Queen empty.
So thank you. And also, going back to work is kind of up to you. You know, after lipo, you are leaking for a few days and stuff like that, and then with the BBL, you can't put that much pressure on your bottom for about 4 weeks. Can't really give you 4 weeks off of work, but usually after lipo and a BBL, people feel better after like a week.
Yeah. Okay. That's pretty fast, you guys. You know, and it's all about your body. I'm sure it's all about how you handle things. So, is it better to use a cell saver to avoid experiencing too much pain?
So the cell saver doesn't really have much to do with pain. It's more about hydration, and then whatever, when we are liposuctioning, we do put in a solution with epinephrine to kind of constrict the blood vessels so it's not as bloody. The cell saver can return some of the red blood cells that are lost back to you, so you feel better with like hydration and recovery and stuff like that.
Great. When will I see the best results after my BBL with J Plasma?
So the final results that you'll see are between like 9 months to a year. J Plasma kind of takes its full effect around 5 months, and then with lipo and swelling and everything, you have to wait about 9 months to a year to see the final result of everything. You have to give yourself patience, because in the first few weeks to a month, sometimes you're swollen, you feel bloated, heavy, and that goes away, and that's normal. That's why we have you in the compression garment and everything, but people get discouraged by that sometimes.
So, baby girl XOXO has a question here for you. I have a question. I hit 7 weeks post-op BBL tomorrow, and I've started sitting here and there, and I have a lot of pain in my tailbone.
So that, I mean, again, case-by-case basis, but the pain sometimes is just related to the soreness if you haven't been sitting or anything. I usually tell my patients you can sit after 4 weeks.
Great. PK6, if your white and red blood cells are 3.9, is that a problem for a BBL?
So if you're, it's more about your hemoglobin. That would be the number.
Yeah. And hold on. So going back to the questions, you guys, any questions you guys may have? I see we're having lots of questions, okay? Keep them coming, you guys. We're gonna be answering every single one of them. So, How can I know if I'm a good candidate for J plasma or if I need another surgery?
A consult. Everybody's different, case by case, and it's best, if you have a lot of questions and stuff, it's best to schedule a consult with a surgeon.
Of course. There's nothing like seeing the person, Of course. So, how can I maintain my BBL results over time?
So the best thing that you can do is diet and exercise. Not so much a diet, but just a healthy lifestyle. And then the gym. So actually, like a lot of, fat, it does add volume and stuff, but there's nothing like, developing muscle. So while this may give you kind of the everything, is illusions. So we are adding fat. The lipo does narrow your waist, stuff like that, to give you the ratios. But if you're actually looking for like that pump and, like the gym booty, that's found in the gym and eating high protein.
Yes, amazing. We have a very lovely comment here. Hey, Dr. Porter, hi. I'm about to see you in 30 days.
Nice, exciting.
Oh, nice. So going back with PK6, she's asking, hemoglobin is at 12.9. Is that okay?
So for me, that's fine. Every surgeon is different. I can't speak for, every surgeon.
So baby girl XOXO commented, okay, yes, I figured it's just from me not sitting. It's definitely getting better with a pink heart. So KNABL is asking, is it true that 40% of surgery goes away post-op?
For fat grafting, yes. So at 1 month, and I tell this to all my pre-ops, 50, it's actually more like 50 statistically of the fat that we graft doesn't survive. So, we try to put in as much as we can, maybe overfill it at first. It depends on the person. Some people have all the space and the fat in the world, and other people have lots of fat but no space. So, you have to give yourself time and patience, and some people do need multiple rounds of fat grafting.
So we have a question here. Hi, how long you wear fajas and boards? How many months if you do tummy tuck and BBL together?
So for the faja, again, every surgeon is different. For my patients, so you start out, if you get a tummy tuck, you start out with the abdominal binder because you have 2 drains. It's difficult to keep the drains in and out of the faja. So after a few days, usually, when the drains are removed, like 10 days, you switch to the garment. I ask everyone to wear the garment 1 month, 24/7, and then months 2 and 3, 12 hours on, 12 hours off. Some surgeons are more strict than that, some are more lax. Every time that we go to a conference, people are always talking about this. Some surgeons don't even believe in garment. It's all over the board. And then for boards, I ask that you not wear them for a few weeks after a tummy tuck because it can cause compression and like skin breakdown, or like ischemia, like extra compression. But in the back, that's fine. 4 to 6 weeks. The tummy tuck, I really don't advise it. So maybe just like a week or 2 if needed.
We have a question here from Debbie Castañeda. Where are y'all located? I want a mommy makeover with hip dips. Well, girl, we're right here. We got you. Here, Dr. Porter can give you that mommy makeover and give you that hourglass figure that you're looking for. Let me tell you something. We're located in Miami, Florida. We have 3 locations here in Miami, Florida. We're actually in the Doral location right now, and this is where our lovely Dr. Porter resides, you guys. So I'm letting you know now, if you're watching me outside of the state or outside of the country, and now you're freaking out because you heard Miami, I'm here to let you know now that we offer free virtual consultations, you guys. So how amazing is that you can get a professional's opinion and get looked at by a professional for free, you guys. I'm letting you know now. Any doubts, any questions you guys may have, go ahead and put them in the chat. Debbie Castañeda, go ahead and put your information right here. In her left bottom corner, you're gonna see this yellow folder. Click that and put all your information. That way we can, assist you in a more direct way.
And just a disclaimer, if I wasn't your surgeon and you're asking post-operative questions, you should reach out to your surgeon for those questions.
Yes. Debbie Castañeda says, sign me up. All you have to do, girl, is go right here in this yellow folder, okay, love? You're going to click it, and it's going to say fill out info. Then you're going to put all your information and make sure to press submit form at the bottom, okay? So, I see here, Lisbeth Ocampo. Hey, Dr. Porter, I'm 7 weeks post-op and loving my Lipo 360 and BBL.
Oh, thank you.
We love to see it, guys. Thank you so much. Thank you so much.
Good to hear from you.
Yeah. Oh, you remember?
Yeah.
That's so nice.
I remember everyone.
That's so nice. So, going back to the question about how much fat survives, it says here, they say only 30% of the fat transferred to the buttocks survives. Is that true? Can I do anything to help my body retain more of the transferred fat?
It's usually about 50%. No, there's not. So what you can do is, not putting prolonged pressure to that area. I ask 4 weeks. Again, every surgeon is different. There's surgeons who don't ask for any time. There's surgeons who ask for 8 weeks. I think 4 weeks is pretty reasonable. And then, not wearing anything too constricting or compressive. Taking good care of yourself. High protein, no smoking. If you smoke, you vape, like anything with nicotine, inhaling, it's not good for the fat either.
Very, very important that we remember those things, you guys. This is an investment that we're making for ourselves, so we gotta stop all those habits that are not gonna contribute to our results, okay, you guys? So, is it possible to prevent capsular contraction?
So everything to prevent it, we do in the OR. So bleeding, having a sterile field, all that is prevented. The capsular contracture that most people experience, and the incidence rates are kind of all over the place, between 10 and 30%. It's more so people are just prone to it. Your body just develops, like an overly exaggerated response to having those implants in. But just, close follow-up with your surgeon if you have any issues, massaging the implants, yeah.
We have a question here. She just has a period as a username, so I'm just gonna say period. Welcome to the live. How long should I wait after a C-section to get Lipo 360 and abdominal etching?
Well, so after pregnancy, the minimum is 6 months, and then doesn't matter if it was vaginal or C-section. For not everyone, if you're depending on the results that you're looking for, if you want perfection, depending on how much fat you have or skin laxity, not everyone is a candidate for lipo, and especially not ab etching. So
we have a question here. Explain cell saving, because we're using cell saving. What's that? I believe you mean a cell saver. Yeah.
So what it is with any type of surgery, if there's blood loss and it's collected, which like with the lipo, where the aspirate sometimes has some blood tinge in it, it's a machine that filters out the red blood cells and is able to give them back to you.
Great, you guys. So, this is something that would be a good use, so that way you don't lose that much blood and you feel more energized the next day, So, how much volume can I add to my breast and CCs?
That depends on what type of, are you asking for fat grafting?
I think fat grafting.
So for fat grafting, you can usually go up about like a cup size. Again, 50% of the fat may not survive. So it does add volume. It's not going to give you the same effect that like an implant will. It's basically going to be the shape of your breast that you have now, but larger.
So we have another question here. And what's the difference between using the natural fat versus something else? What do you mean something else?
Oh, like Sculptra, maybe? So I don't do Sculptra here. But using your fat, it's, you can get more bang for your buck. Sculptra can get very pricey, especially depending on the size that you're going for and stuff, but and Sculptra is obviously not your own tissue.
Yeah, so I think it's way better to like get a fat transfer. Somebody said I got the cell saver with my BBL with Fisher and it was 100% worth it. Yeah, Lily Mac, I'm telling you, I can guarantee you that you probably felt a whole lot better than you would have felt if you wouldn't have gotten cell saver. So I highly recommend you guys, as well as the surgeon here, we recommend getting cell saver, you guys, okay? So I believe here, K and ABL, the same person that asked you the question about the sculpture. So if we use fat grafting for 50% sanguinal lasso, that's why you go super big at first.
Yeah, I mean, it all depends on what your goals are and your results, and again, what we're starting with, your anatomy, what it can handle. A lot of times people will come in with photos of something that really isn't their body shape. Not everyone is shaped like, you know, like super hourglass figure. Yeah, so we have to work with what we have.
I have a significant asymmetry in my breast. Can this be corrected with surgery?
So yeah, that can be, but you have to remember, even after surgery, and even for people who really don't have much asymmetry, everyone has asymmetries. Nobody will ever be perfectly symmetric, especially the breast. They are sisters, they are not twins.
Sometimes they're even cousins. Yeah. Is it true that I can get chin lipo with local anesthesia?
Yeah. Yep.
You guys, look at this promotion. Look at this promotion right here. That question was, that question was for you guys to realize. Right now, we have local anesthesia chin lipo. So don't let yourself be walking around with a double chin in 2025, you guys. So come on, go ahead and leave your information right here in my left bottom corner in this yellow folder, okay? So, do you use ultrasound guidance when performing a BBL to avoid injecting into muscles or blood vessels?
Yeah. I always use the ultrasound. I inject superficially too. It's not worth the risk of going deep for me. But yeah, the ultrasound is helpful to see where the fascia is, where the muscle is, everything like that.
Yeah, but they have a clear view of absolutely everything that's going on throughout the whole surgery, guys. It's actually pretty amazing. So we have more questions from KNB AMBL. Super big, meaning the initial BBL will be super big because 50% leaves. Dr. Porter, sorry for having a lot of questions. We're coming from Virginia.
Again, it depends on your body type. So, you know, there are some people that you could inject a liter into, and you know, there's state laws and regulations for how much fat we can take off, how much we can inject, but and it would do nothing because you have like a larger butt to begin with. There are other people that can't even handle a liter because of like the space. So it's all person to person. Nobody is the same. You know, no two butts are the same. No two bodies are the same. Everybody handles things differently.
Yes, that's right. So PK6 has a question that says, how long does a BBL take in operating room?
It depends, again, on what we're starting with. If you're super tiny, don't have that much fat, then it's not going to take too long. Then there are some people who are a little bit bigger, have more fat. That takes a while. The BBL part itself doesn't really take as much time. It's more so the liposuction. And the liposuction too, if you do have more fat covering your waist and you naturally have a smaller waist, then you know that's going to give you more of like that, more so than the fat grafting will at first.
Of course. We have a comment here that says, and the recovery staff was amazing. Thank you so much. That means a lot to us, you guys. We work really hard together as a team to make sure that you're having the best experience when it comes down to plastic surgery, okay? So, Blue 11, after 6 weeks, when I start sitting, my BBL can be smaller.
So, no. 4 weeks to me is fine. Whatever has survived is going to survive at that point. More so initially, and then, you know, there are some patients that come back for a second round and they say that they feel that they didn't lose any volume.
Amazing.
Fantastic.
Amazing.
Some people come and they say that they feel like the fat all went away. So it's very person to person dependent again.
Of course. How long does the drainage process take?
So usually the drainage process takes, like significantly draining. The first few days, all that fluid that we get in to emulsify the fat, it needs to drain out. But every time you get a massage after that or something, you may be draining more because that's the point of the massage.
Lymphatic massages are crucial, you guys, for you to be able to see those final results, okay? So we have it's such a cute comment. Waisha Villa. Dr. Porter did my surgery and she did amazing. I'm very happy with my results.
Oh, thank you.
And then we have another comment here from Caitlin Wilson. I can't wait to see you May 20th, Dr. Porter, with a red heart.
Nice. Excited to see you too.
Very nice, very nice. Is the upper back included in Lipo 360? What areas are actually included?
So no, the upper back, if you draw kind of a line from your, like here down to the middle, it's like kind of a V down to the middle of your upper
Like the
back.
bra strap?
Yeah, like the bra strap kind of, and then lower to that, down to like over the butt, the sides, and then the 4 quadrants of the abdomen. Everything's broken up into quadrants. It's not so much, for like what the surgeon is doing. It's more for, I think, anesthesia purposes, but that's what Lipo 360 is.
Do you recommend J-plasma?
It depends on the person. If you're in between wanting or needing like a tummy tuck, but you don't want the scar, then yeah, it can help. Or same thing with like back rolls. Sometimes it can contract in the tissue. I've seen some success stories with it, and others probably got more contraction than they would have with just lipo, because with lipo there's no guarantee that there's going to be skin contraction. But if you truly need a tummy tuck, if you have a lot of stretch marks, if you have a lot of like excess skin, J-plasma, I don't think it's going to help.
Would you perform a BBL and breast surgery on the same day?
I do. It's probably my least favorite because it's a lot of time under anesthesia, so it depends if it's the right candidate.
So, KNABL is asking, what's 12-point lipo? Like, what are the 12 areas?
So same thing for Lipo 360. So your abdomen is broken up into 4 quadrants, the 2 sides, and then the back areas again in quadrants.
Yeah, very important, you guys. Why Sheila Villa said I'll go back for round 2. Okay, she ready. So KNABL is asking, can you go a little over 1
liter?
1 liter.
Oh, so in the state of Florida, legally, if it's a combination procedure, so somebody just asked about breast and a BBL, you can only take out 1 liter of fat. So regardless of your size, how much fat you have, you get 1 liter out, and that's what. So then into each bottom, 500 cc's and 500 cc's. If you want to take a measuring cup and measure that for yourself, to see how much fat that actually is, and then keep in mind that 50% of it dies. And then if you're not getting a combination, so just a BBL, it can be 4 liters.
Nice. 4 liters. Nice.
Every state is different.
That's true. Do you operate on patients with high blood pressure?
As long as it's well controlled, you've seen your medicine doctor or whoever's prescribing it for you. But if your blood pressure is high, before surgery, then it's not worth the risk.
So, I'm telling you guys, book Dr. Porter. She's really good.
Thank you.
Thank you so much, Villa. Thank you so much. So, here we have, he said, just call me L. I'm just going to call you L. You're right. Why do people go back for round 2? So, he's asking.
So, it's just up to the person if they felt that there wasn't enough fat, or if there's some things sometimes it depends on how your body reabsorbs the fat. A lot of times the hips are very difficult to fill in too, everybody wants to get rid of these hip dips, but sometimes there's like a ligament or something that's tightening. Some people just want like minor things fixed. It's very up to the person to round to.
Do you perform lipo on the stomach when a tummy tuck is done?
So not usually, because a little bit, but mostly just the sides. It's kind of risky, especially in this environment, if you're not going to be staying, you know, for a while afterwards, because that's how you can get more, you know, wound breakdown. That's a risk with the tummy tuck in general, but it's definitely an increased risk with extensive liposuction and a tummy tuck.
What do you recommend for iron deficiency before surgery?
Iron, eating foods high in iron, and then, you know, your doctor, your primary care doctor should be able to help you with that.
Of course. So we have 2 questions here. I think L got a little confused, so he's saying, so is the 12-point / BBL one procedure, meaning 1 liter or 4 liters?
So 12, like that's just where the liposuction happens. So your abdomen, your sides, and your back. That's the areas, you know, that however it's broken down for billing. And then the liters is like how much fat that we can remove. So it depends on if you had a combination procedure or if you had just a just a BBL or just lipo.
Yeah. So I think he's asking like if it's a BBL and lipo, is it 4 liters?
Yeah.
Yeah. Okay.
But if you had a tummy tuck, that's 1 liter.
That's 1 liter. Oh, okay. Look at that. He's so funny.
But not everyone has 4 liters to remove.
Yeah.
Too.
That's
especially
true.
if you had lipo before, or like J plasma, it does make it harder to lipo.
She said iron. I love her. So we have another question here that says, I do BBL and lipo 360 with J plasma. You can put the 4 liters or only 1 liter? 4 liters, you guys. When there's BBL involved, 4 liters. When there's tummy tuck involved, only 1 liter. Okay? So, as I was saying.
But, and again, it's person by person, because not every butt is gonna hold. Most people cannot. So, and then not everybody has 4 liters of fat. Some people have more than that. So it's very patient specific.
You re-asked perfectly, because that's what I was asking. No, yeah, I understood, because, you know, that's been me too, you know, so it's completely fine, you guys. I got you. From 4 liters, here we come. That's so funny. So, you guys, we have a couple of more questions left for Dr. Porter, so if you have any more questions, this will be the time to ask them, okay? So, is lipo only performed on the chin area, or does it also include the neck when we're talking about chin lipo?
For me, I do some of the neck too. I think that's where you get the most bang for your buck, is like kind of like here, you know, the neck. Not every surgeon is different, but that's how I do it.
Great, great. Can I add J plasma to the neck area as well?
Yes. Yep. That adds like increased skin contraction and gives you like, J plasma gives you 50 to 60% of skin tightening. It's never gonna do what, you know, a surgical or skin removal will do, but it can help like the jawline or just like skin contraction, sometimes even like a little bit with the jowling.
Yeah, that's amazing. That's really great. What other procedures can be done with local anesthesia?
So you can do lipo pretty much anywhere with local anesthesia, but you have to, like a 360, it's not going to be ideal under local, because you have to add in lidocaine. You can only tolerate so much lidocaine per kilogram of your body before it can cause adverse effects. So if you wanted to do like lipo of the abdomen, yeah, that can be done under local anesthesia, or if you're willing to break it up into different parts.
So, I was asking, can you pull from the arms, triceps, and
Willing to break it up into different parts.
So, I was asking, can you pull from the arms, triceps, and biceps? I think remove like fat from, you mean like, when you say pull, do you mean like fat from those places, or what do you mean by that? Let me know. He's saying, trust me, Dr. Porter's gonna definitely remember me and say, what the hell? Let us know what you meant by can you pull from the arms. I believe if you mean like fat, I'm pretty sure you could like get
Yeah,
some
you
from
can
the arms.
lysol the arms, definitely.
Yeah. Could you do under local anesthesia?
Yeah.
Okay, that's great. What about like inner thigh, like?
Yeah.
Oh wow, look at that, you guys. So if you are having some issues where you want to remove fat from your arms, or maybe your inner thighs have been chafing lately a lot, this could be a great alternative for you to finally not have to deal with those things anymore. Okay, you guys, so with that being said, those were all the questions that we were gonna ask today to our lovely Dr. Porter. Okay, thank you guys so much for all the love, all of those beautiful comments. We always have such an amazing time with Dr. Porter. We absolutely love her. He said, okay, fine. So thank you guys so much for being on this live today. Thank you, Dr. Porter.
Oh, no problem.
Of course, you guys. So now Dr. Porter actually has to go see a pre-op, I believe. So we're gonna go ahead and say bye to Dr. Porter. Thank you so much for your time, doctor.
Thank you.
And remember, you guys, we have that amazing promotion for the local anesthesia for the chin lipo. And when I'm telling you, she's gonna get you right. She gets the neck too, you guys. So she makes sure that you look as slim as possible. Okay, so I'm letting you guys know now. Dr. Porter is here to change your life, and she's here to enhance your body in ways that you've probably always dreamed to have your body enhanced. Okay, so I'm letting you guys know now. If you've been looking forward to getting surgery, like, you guys, this is the perfect time. This is the perfect time. Yes, I want all that type of shit. Yeah, I'm saying though, right? Like, yes. And I'm telling you now, like, she is someone that is so special. She's so sweet, and like, she'll really like gets in great detail about absolutely everything. Like, all the questions that you guys were having, absolutely everything. When you are having a consultation with her, whether it be virtual or in person, you really get to see like how much of an amazing surgeon she is, because she's very realistic. She's very, will tell you, will educate you, will guide you, will check up on you, and that is something that you want to have, because a good surgeon isn't only gonna give you good results. A good surgeon is gonna genuinely prioritize you as a patient, from health to how you're doing, to your results. Are you drinking water? Are you walking around every hour, 15 to 20 minutes? Are you eating high in protein? Are you doing everything that you're supposed to be doing? You guys, when I'm telling you now, these are things that we must be on top of, because we gotta be making sure that absolutely everything that we're doing is being done the right, correct way, you guys, okay? So please, let me tell you something. Right now, you can get $100 off your procedure just by leaving your information right here in my left bottom corner in this yellow folder, you guys, okay? So I'm letting you know now. Stop playing with yourself. If you've been had your eye on Icon Cosmetic Center, or you've probably been on the hunt trying to find the right clinic for you, and you just haven't really gone through with one because you kind of like are still iffy and stuff like that, I'm here to let you know, love, that it's not a coincidence that you're here today. I'm here to let you know now that when you're looking for excellence in every single like area, like in every single field, not just with good results, but with care, with attention, feeling prioritized, feeling comfortable, a clinic that is gonna do checkups on you. Like, we're literally gonna be blowing up that phone if you don't show up to your massages, if you don't show up to your post-op. Okay, I'm telling you guys now. So it is extremely important for you guys to remember that absolutely all of these things, all of these boxes have to be getting checked out, you guys, because at the end of the day, we want more than just good results. We want the full experience, okay? The results, the treatment, the care, the attention, okay? So those are things that, sorry guys, those are things that are really important for us to remember and for us to keep in mind as well, because at the end of the day, this is exactly what you anticipate for, what you would expect from a clinic, and that's exactly what Icon Cosmetic Center consists of, okay? So I see here Dr. Porter is so amazing and sweet. Definitely recommend. Thank you so much, love. Thank you so much. That means the world to us. Lisbeth also said she listens to you and gives you the results you want. I know that's right, girl. Yes, she really does. She really does. And you know, she's always gonna have your best interest in mind. Like, even when she thinks that maybe what you want, you know, it could be enhanced in a better way where it will look better, you know, she's gonna let you know, like, hey, look, we could use that foundation and also do this and add some of this, or put some here instead of here, you know. Like, she is just so amazing in the sense that every single one of our 8 surgeons have a surgeon's eye. What does that mean? That, you know, like, they just take one look at you and they know exactly what to do with you. Like, you know, you just tell them, like, I want to look like this, I don't want to look like this, but I want to kind of look like this, and I want it to be like this. And they'll deliver every single time. I'm telling you now, the results be resulting, okay? I'm telling you guys right now, it is something really, really amazing for us to see. So, as I was saying, wait, is lymphatic massage included post-op? So, it's not included post-op, you guys. You do have to pay for your lymphatic massages. And this is something that I could go on and on and on about, because massages are so important, you guys. You know, when we're getting lipo, a tummy tuck, a BBL, you know, these are extremely, extremely, extremely important for us to remember, okay? You know why? Because the thing is that 50% is you finding a good surgeon, but 50% of those results are also, you know, how you treat yourself. The massages, how are you wearing your faja? Are you being disciplined with your faja? Are you using your boards and your foams? Are you getting the massages professionally done by a certified masseuse? Lucky for you guys, here we always have, like, we literally at all times have certified masseuses here at Icon Cosmetic Center in all 3 of our locations. You know, in the Doral one, in the Hialeah one, and in the Blue Lagoon one, okay? We have amazing certified masseuses that know all the right techniques, know how to detect liquid retention, and know how to work with every single type of body type and every single kind of case. Okay, you guys, so I'm letting you know now, with everything that we have to offer here at Icon Cosmetic Center, honestly has never been easier like today right now for you to finally get your surgery. Okay, so another thing that I wanted to mention to you guys that is extremely important as well that we remember is that here at Icon Cosmetic Center, it is extremely important for us to also remember as well what's Dr. Porter's location, since y'all have 3 locations. She's in the Doral one. So the one that I'm currently in right now, she's in the Doral one. And let me break it down for you real quick. So here in Doral is Dr. Porter and Dr. Fisher. In the Hialeah location is Dr. Tamer, Dr. Zong, and Dr. Harrell. Okay? And in the Blue Lagoon location, she's in the who's there is Dr. Giselle Guarani, Dr. Guarani, and Dr. Meridian. Okay, you guys, so I'm letting you guys know now with everything that we have to offer here at Icon Cosmetic Center. It honestly has never been easier like today right now for us to finally be able to get our surgery, you guys. So these are things that are extremely, extremely important for us to remember. Okay, another thing that is important for us to remember, you guys, is that when we're looking forward to getting surgery, you guys, we want to be making sure that absolutely everything that we're doing is being done the right, correct way. Okay, so another thing that I wanted to mention to you guys that is extremely important for us to remember as well is that here at Icon Cosmetic Center, we're always going to be making sure that absolutely everything that we're doing in the right, correct way. Okay, you guys, another thing that I wanted to mention to you guys that is extremely important that we have to remember as well is that, you know, here at Icon Cosmetic Center, we also offer amazing financial plans, you guys, that you could like take great advantage of. I'm letting you guys know now with everything that we have to offer here at Icon Cosmetic Center, honestly has never been easier like today right now for you to finally get your surgery, you guys. Okay, so, you know, whether you've been having in mind whether you've been having in mind getting a breast augmentation, or getting a breast lift, or getting a BBL, or a tummy tuck, or a mommy makeover. I'm telling you guys now, with everything that we have to offer here at Icon Cosmetic Center, it honestly has never been easier to finally get your surgery. Like, I know that sometimes we may believe that it's gonna be like almost impossible to finally get our surgery, but I'm letting you guys know now that with everything that we have to offer, it's actually never been easier for you to finally get your surgery. Okay? And you know, whether you've been whether you've been, you know, looking forward to getting surgery, and the reason why when we are, you know, looking forward to getting surgery, guys, and we may think like, oh, it's gonna be too impossible for me, or you know, I have to pay it in full, or you know, certain things happen in your life that don't allow you to finally like get your surgery. I'm here to let you know now, you guys, that it's 2025, and all the decisions that we make are up to us. So if you feel like you haven't been prioritizing your surgery, then you probably most definitely haven't. And you don't have to settle for things. Like, how do I say this? You don't have to settle for the things that you don't want to deal with. And you don't have to settle for the things that you don't like in any kind of situation. This doesn't just apply for surgery. And that is something that we get to learn, you know, in life. And I feel like when we're looking forward to getting surgery, when we're seeking to get surgery, is because we're clearly like, not that we're not happy, but you know, it's just that we're not satisfied with something, and we don't have to settle for that. And there's nothing wrong with you wanting to enhance and get rid of whatever is bothering you. So the point that I'm trying to make here is that it's 2025. Don't let the years keep passing you by, and don't let these promotions keep passing you by when you could have been gotten your surgery. Okay, I'm letting you know now, you know, there's no amount of money in the world, it's priceless, when I see our patients literally cry of joy. Like, they just can't believe that that's their body. They just can't believe that that's their breast, that that's their abdomen, that that's their booty. They just are so stunned with themselves, and that is something so beautiful to see. That is something so beautiful to witness. Okay, you guys, so I'm letting you know now, like, if there's something that's been bothering you, just go ahead and get it. Like, you don't like something, go ahead and do something about it. Go ahead and put yourself that goal. I feel like when we set goals, you guys, it's easier to go after what we want, you know, because when we just talk about it with our partner, or with our friends, or with our family, or with our acquaintances, our co-workers, whoever, you know, then it just kind of becomes a conversation instead of a reality. So, and that applies for everything, not just surgery, you know. So that is something that is really important that I wanted to mention to you guys, because, you know, I see a lot of you guys want to get surgery. So I'm letting you guys know now, we have amazing financial plans. We have these amazing promotions and specials that you can take great advantage of. Okay, you guys, I'm letting you know now, it is your time to shine. Okay, it's your time to shine. So I see here, I'm seeing here, we have a comment that says, nah, I'm cashing out. I'm telling you, it is honestly really amazing to see everything that we have to offer here at Icon Cosmetic Center. Is something that you guys need to be taking great advantage of. Okay, I'm letting you guys know now, with everything that we have to offer here at Icon Cosmetic Center, it honestly has never been easier like today right now for you to finally get your surgery. Okay, you guys, so with that being said, I'm gonna tell you real quick about our financial plans. So for a BBL, you can pay as low as $29 weekly or $129 monthly. Okay, so extremely important that we remember all of this amazing information, you guys. You want to be making sure that you're knowledgeable, that you know absolutely everything that we have to offer here at Icon Cosmetic Center, you guys. Okay, another thing that I wanted to mention to you that is extremely important that we remember as well is that here at Icon Cosmetic Center, we're always going to be making sure that we are giving you the best of the best, okay? So extremely important that you guys remember all of this amazing information. Now, another thing that I wanted to mention to you guys that is extremely important that we remember as well is that a BBL, like she was saying, you know, a BBL is a fat transfer to the buttocks, you guys. So with that being said, you know, make sure that you are receiving you know, all the education that you can. I know sometimes we wanna educate ourselves on like social media like YouTube and TikTok and Instagram, but what I'm about to say is really important, you guys. So listen, when we are looking forward to getting surgery, you guys, one of the things that is really important for us to remember is that when we're looking forward to getting surgery, you guys, it is really important for us to remember, like, we could go ahead and, you know, do our research. We could go ahead and find out like about the clinic and stuff like that, but it's really important for us to remember that when we're looking forward to getting surgery, you guys, it is extremely important for us to remember that we have to be making sure that everything that we are doing, you guys, everything that we're doing and everything that we're like searching up, we remember to not compare our healing processes to another person's healing process. That is something that it is extremely important, and let me tell you why. The reason to this, you guys, is because, you know, it's not like a reliable thing for you to think that your healing process is gonna be exactly as someone else's healing process, because the beauty about us humans actually is that we're all unique in our own way. Like, you know, we are never gonna be exactly the same as someone else. So that is something that to remember, you know, it applies to for surgery, you guys. So that is something for us to remember and for us to keep in mind, because, you know, like how I was telling you guys, these are things that at the end of the day, you know, it's good to have the knowledge on, and it's good to have like the understanding on, because I feel like a lot of people go on social media and expect their healing process to be just as slow or just as fast as somebody else's healing process. And, you know, with the massages, going back to the massages, I'm gonna give you guys an example of what basically I mean is that, you know, the minimum of massages that you should be getting should be like 30 to 40 massages, and that's really minimum. Like, when I say the word minimum, I really do emphasize on the word minimum, okay? That's as like minimum as so it can get, okay? So with that being said, you know, another thing that I wanted to mention to you is that with that being said, you know, you want to be making sure that just because you saw somebody that only got 20 to 25 massages and they didn't experience any more liquid retention doesn't mean that you're gonna retain liquid the same, because they don't have the same blood circulation, they're not retaining liquid the same as you, they don't have the same skin elasticity as you, they probably aren't even getting the same surgery as you, and there's probably many different other factors in their specific body type and in your specific body type that are just completely different, okay, you guys? So those are things that are extremely important for us to remember, for us to keep in mind, okay? So with that being said, you guys, make sure that absolutely everything that I'm telling you today, you know, you remember, you reflect on it. And if, you know, if you feel like we said a lot of information and like we were talking just a little too much and it's a lot to remember, don't worry, you guys. You know, here at Icon Cosmetic Center, we literally go over absolutely everything that you need to know with you as many times as you need us to, okay? That is something that we are always going to be making sure of. So extremely important for you guys to remember that information as well, okay? So another thing that I wanted to mention to you guys that is extremely important that for us to remember is that here at Icon Cosmetic Center, we're always going to be making sure that you are receiving the best of the best, okay, you guys? So with that being said, you know, we're always going to be making sure that absolutely everything that we have to offer to you guys, you know, is being done the right proper way, okay, you guys? So extremely important for us to remember that as well. Now, another thing that is important for you guys to remember as well is that here at Icon Cosmetic Center, we're always going to be making sure that you are getting absolutely everything that you're supposed to be getting in the sense of like education. You know, for example, for the people that are low on iron, I highly recommend you getting Fluoridex, you guys, okay? I highly recommend you getting Fluoridex. This is gonna help your immune system and your hemoglobin to go up a whole lot. You know, I believe you take like 2 tablespoons of 10 ml, or it comes with a measuring cup, and then you just take 2 of 10 ml and you're good to go. I believe that's like for adults, the adult dose. So yeah, you guys, you know, if you want any tips or any questions, you know, I'm here to help you out, and I'm here to guide you. I'm here to educate you. You know, that's exactly what I'm here for. Another thing that I wanted to mention to you is that right now you can get $100 off your procedure. And let me tell you something, this applies for any procedure. Any procedure: labiaplasty, vaginoplasty, tummy tuck, mommy makeover, breast augmentation, BBL, Lipo 360, you know, am I missing something else? I don't think I'm missing something else. But you know, even for like specific areas of lipo, I'm gonna tell you like the most common areas for lipo and the not so common areas for lipo. You know, like the most popular ones and the ones that are not as popular, that I bet you didn't know that you could get lipo in those areas. Well, the most common ones are the chin, of course, the chin lipo, the upper back, the arms, and the inner thighs. Okay. Now, the not so common areas for liposuction is the pelvic area. You know, the pelvic area, your armpit, like in between your breast and your arm, like your armpit right here. Like, you know how sometimes we can get a little roll right there. Okay. So the armpit, the pelvic area, the neck, the buccal fat, you know, to kind of slim this down, make it more narrow and more slimmer. And you can also get lipo on this area, you know, like on your lower knee, on your calf, like right here on this area. Okay, you guys, so those are the most common and the not so common areas for liposuction. Another thing that I wanted to mention to you guys about tummy tucks is that for a tummy tuck, you know, there's two different kinds of incisions when it comes down to having a tummy tuck. One of them is called a mini tummy tuck, and the other one is called a full tummy tuck. So, you know, the mini tummy tuck is, the incision is from bikini line to bikini line, so the incision is from here to here, you know, and the incision for a full tummy tuck is from hip to hip. Okay, you guys, so extremely important that you guys do remember this amazing information, because I'm letting you know now, with everything that we have to offer here at Icon Cosmetic Center, it has honestly never been easier like today right now for you to finally get your surgery, you guys. So, you know, extremely important that we do remember that information. I see here what kind of surgery y'all do. So we do all kinds of surgeries, you know, mommy makeovers, tummy tucks, BBLs, Lipo 360s, breast augmentation, breast lift, breast fat transfer, breast reductions, vaginoplasties, labiaplasties. Okay, so we do a whole lot of different procedures. So if you've been looking forward to getting surgery and you just haven't found the right clinic, I'm here to let you know, love, that you have found the right clinic today. It's not a coincidence that you're on this live watching me right now. So go ahead and leave your information right here in my left bottom corner in this yellow folder. Okay, you're gonna see services plus, and let me tell you something right now, you can get $100 off your procedure. Okay, you guys, you can get $100 off your procedure, any procedure. Okay, and all you have to do is leave your information right here in this yellow folder in order to be able to activate it. Okay, you guys, so I see here, what does Lipo 360 include? So Lipo 360 is like this. So let me move my hair, let me open this. So Lipo 360 is like this. It's your whole front abdomen area. Like, you know how sometimes we can get like these little rolls right here or right here, like our fupa. So it's your whole front abdomen area. Then it's your flanks, you know, like this right here, your flanks, this area right here, this area right here, and then it's your back. Okay, like your love handles, your back, all the way up to the bra strap. You know how sometimes we can get those really annoying rolls right under our bra strap. You know, it takes care of that entire area. So just to let you guys know. So yeah, that's what the Lipo 360, you know, consists of. That's what it includes and stuff like that, you guys. So that is something that is really, really, really important for us to remember and for us to keep in mind when we're looking forward to getting surgery, you guys. Another thing that I wanted to mention to you that is extremely important that we remember as well is that here at the Cosmetic Center, we're always going to be making sure that you're receiving the best of the best. Okay, you guys. So extremely important that you guys do remember this information. Okay, another thing that I wanted to mention to you guys that is extremely important that we remember as well is that here at Icon Cosmetic Center, another thing that I wanted to mention to you guys is that here at Icon Cosmetic Center It is extremely important for us to remember all of this amazing information. Okay, you guys. So, another thing that I wanted to mention to you guys is our locations. In case you don't know them, we have 3 locations here in Miami, Florida. You know, we have one in Blue Lagoon, in Doral, and in Hialeah, okay? What's the minimum age? 18? Yeah, 18 and older. 18 and older. So if you're looking forward to getting a BBL or, you know, tummy tuck or whatever it is that you're looking forward to getting done, 18 and over, okay, you guys? You do gotta be 18. So with that being said, you guys, thank you guys so much for joining the live today. Stay tuned as we'll be coming back real soon with more exciting news, more educational topics. So I'm letting you guys know now. Go ahead and leave your information right here in this yellow folder in my left bottom corner, you guys. You can get $100 off your procedure, okay? Any procedure you have in mind, you can get $100 off your procedure just by leaving your information right here in this yellow folder. That's all you have to do in order to activate it, you guys, okay? So make sure you're doing that. Make sure that you're prioritizing yourself and make sure that you're going after what you want because you deserve it, girl. What are you waiting for to become an iconic doll? Thank you guys so much for joining the live today. We'll see you back very soon. Have an amazing rest of your day. Bye.